Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. I want to switch a little bit, Dr. Grand-Pichet. Our friend that's in Mexico right now has written in and said that their child is 8. He has been prescribed Sertraline, 50 milligrams, half a pill. This is to help with anxiety. He started taking it a week ago. They go on to say that the behaviors are still there. He's grinding teeth and showing still some pretty intensive signs of anxiety, and they're wanting to know your opinion of prescribing these kinds of medicines, and are they actually helpful?
Yeah, thank you for that question. So sertraline is the chemical name for Zoloft, and Zoloft is a selective serotonin reuptake inhibitor, SSRI. And what that means is that this medication, when we in our bodies, in our nerves, all of our neurotransmitters, the way that our nervous system communicates throughout the body is that each nerve produces a neurotransmitter, a chemical, and then that chemical is taken up by the next nerve cell, right? So each of our cells, this is how they communicate with each other. SSRIs, all they do is they keep that neurotransmitter in the synapse, which is the area between the two nerves, for a longer period of time. So the second nerve has more opportunity to get the serotonin. So they basically increase our serotonin. And when our serotonin levels, which is one of our neurotransmitters, when that increases, we do tend to feel less anxious. So yes, I absolutely support SSRI treatments for some of our children. Especially, I feel, Shannon, I very, very strongly feel that a large number of kids and adults who are autistic have anxiety, and you would, first of all, a lot of society in general is struggling with anxiety and depression at the moment, but I feel that people on the spectrum even more so, and that's only because they have a harder time understanding what's going on around them. They are more sensitive to stimuli in their environment. They are often sleep deprived. As you know, Shannon, I always say that I feel I try very hard to understand how our patients or our children are experiencing the world, right? So I try very hard to put myself in their shoes. And I remember one time when I was in China, I had not slept. I had very little sleep because I was jet lagged. And I couldn't understand what was going on around me at all because the letters are not even in English, like Latin letters. They're, Chinese letters. You can't read anything. You don't understand the language at all. You can easily get lost. In fact, when you leave your hotel, they give you a little piece of paper to give to the cab driver because nobody speaks English. So they want to make sure you're not going to get lost. So, and like, there's lots of noise, there's lots of pollution, there's lots of like overwhelming sensory stimuli that I remember, honestly, all I wanted to do was like go back to my room, close all the windows, and just calm down. So I completely understand that our people on the spectrum will, in my opinion, will experience more anxiety. And SSRIs are very helpful. The good news is you've only had your child on an SSRI for a week. Typically, it takes 3 weeks before you see any kind of response with an SSRI medication. So please don't give up. And then the other part of this is that with autism, like many other disorders, medication alone is not going to be enough, and you sometimes need, the best opportunity is to have medication and therapy, and those two together work very, very well. So with your child, for instance, it would be easy to teach him not to obsess over his therapy swing behaviorally, especially if he has the support of an SSRI medication. He will care a little bit less. So that's kind of where it's at. I think you just need to stay on the SSRI, on the Zoloft. Zoloft is a very light SSRI, and let's see if that helps. If it doesn't help, please don't give up. Go back to the physician, and sometimes they need to up the dosage. Sometimes they need to change to another SSRI, and then you'll have a very significant effect.
We've had a lot of people writing into the chat about medicines that their child is on, or that medicines that they're on themselves, and how helpful it has been. So I encourage you guys to be looking what some of the other viewers are saying.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.